talk a little bit about postnatal depression. So the vast majority of the public don't really understand, what does that mean?
Postnatal depression, obviously when I was going through it myself, I think I was kind of in denial of what was happening, because at the time I just felt as if I was a failure. I couldn't obviously cope at home. I found simple chores really hard to do, and obviously with having my youngest, I felt it was quite impossible to do a lot of things. I just felt as if I was in a really dark place. I felt as if it's as if like you're in a dark hole and you can't really get out of it, and it's as if you want to see that light. And yeah, it's not really a nice place to be, and I really do sympathise with those obviously that do go through it themselves. But obviously I feel as if Rob was just my support, because he obviously went through that through work. He obviously done that as work basis, and then obviously he realised what I was going through that time.
Now, if somebody said they had a calf injury, and I'd say, when did you first trace your calf? And they might say, I was running down the road in Old Harlow and I hurt my calf. I can remember that moment. Can you remember any moment you're thinking, I'm not feeling right here?
It was kind of like, in some way I didn't feel as if I had any emotions at one stage, and I just obviously wanted to kind of click myself out of it, and we'd be like, people say, pick yourself up, pull yourself together. And I just felt as if I couldn't, and obviously I needed support that way. I had to go to the doctors in the end, and a lot of it obviously just was moral support and my friends and my family.
But did you get a lot of pull yourself together?
Yeah, I did, and it wasn't until that time I realised that I needed to do something for myself.
And do you think in some ways we might still be back in the 19th century of people saying, you're just feeling sorry for yourself, you're not actually ill? And do you think it's quite surprising in 2014 that still exists? Yeah,
because I think, like you say, because you can't see the problem, obviously you have people say, you've hurt your leg, you've got a broken leg, you can see that. But obviously with mental health, it's something that you feel yourself, and if somebody hasn't gone through that, it's really hard to explain to somebody how you're feeling at that time.
But are you worried, here we are, we're interviewing you on film, were you ever worried about talking about it because of job prospects and job future, and people might look on your record and stuff like that?
Yeah, definitely. I mean, obviously, because I was going for nursing, but I was, obviously I was honest, and I could say now that my work has really helped. The people there have really been great. I've adapted lots of friends. And my job opportunity has been great. I got Employee of the Month when I was there. Obviously that was in November. And I just feel like my confidence has grown and I'm a better person myself.
So how have you, to use a crude term, climbed out of that trough?
A lot of it obviously was doing things for myself. Obviously that's why I had to go back to work. And it was just having confidence in myself, and I just feel as if that I'm doing something that I was good at, and now I can see that I was meant to be doing this.
So what is your advice to maybe many women in Harlow or beyond Harlow who may be in a similar situation? They've got 2 children and it's the first few months of the second child or whatever. What's your advice if they're thinking, I'm struggling here? What's your advice?
I'd just say to them, carry on with what you're doing a fantastic job. It's not an easy job being a mum, there isn't a book. Like obviously, if someone was to say to you, oh, there's a job, you got, no money to come from it, no sleep, parental responsibility. I don't think a lot of people would go for that job, but it's an amazing job, and I just say that, mums out there and parents, just carry on what you're doing, because, it's as if you should get an award at the end of it.
To what extent, for example, did you go and see your GP, and was your GP a help for a start?
Yeah, I went to the GP. I just kind of obviously broke down. I just said to him that I couldn't cope, and I think a lot of it with me as well was I was kind of feeling guilty and frustrated because I should have felt that I could have been doing that, because obviously I was a mum, and the fact as well that I was a childcare practitioner, I felt as if I should be that super mum, and it was a kind of guilt to myself, thinking why can't I do it. and more frustration. But they obviously, sympathised with me. They said to me, it seems that you're going through depression and that you didn't notice that you had postnatal depression at first. Obviously, yeah, I had tablets and yeah, I'm
Some people might be scared of medication, but if somebody was scared, what would your advice be?
Obviously, medication does help. It keeps like an imbalance in your brain. I think that's what a lot of it is. You put so much pressure on yourself. It's as if like it's a Coke bottle and you shake it up and it gets to a stage where it needs to explode. And obviously, in that kind of terms, with the medication, it keeps you calm a lot more. You get your thoughts about in your head right, and yeah, it does help, but it's not it's not long term. It does, you don't have to be on long term. You get through it yourself.